I was muted. Okay. Hi, guys. I do that all the time. If you're new to watching me live, there's always a button that I forget to push. So I was saying, welcome to my 35-day nursing school mindset edit. So over the next 35 days, I'm going to be taking you through kind of a major mindset shift about nursing school. Okay. So you can catch me here on the Straight A Nursing Facebook page or on my YouTube channel. So if you subscribe to the channel, I believe you'll get notified when I'm going live. And then I'm going to include a link in the comments for wherever you're watching this that shows you the full schedule. And you can take a look at all the topics and what times it will be available every day. Okay, so today's topic is 5 ways that nursing students struggle. And the good news is that all of these ways are completely avoidable. So it's just being aware that these things are out there and shifting how you think about it, doing that prep work ahead of time, and telling yourself, I don't have to struggle immensely in nursing school. I know there's a lot of negativity out there in like the social media world and the rumors about nursing school. And most of what you hear is how students are struggling and having a hard time. And yes, students do have a hard time. Nursing school can be really challenging. That can really affect your mindset. And you can go into nursing school thinking that struggling is inevitable. And I'm here to tell you that it's absolutely avoidable with some proper planning ahead of time. Okay. So are we in agreement with that? Okay. And Melissa, I think, is laughing. Somebody watching the broadcast is laughing that I didn't unmute myself. Yes, Melissa, I do that all the time. It's probably funnier for you than it is for me. Okay, so what I'm sharing with you today, you guys, it's not going to make nursing school any easier. The content is not going to be any easier for you, but it is going to make it easier for you to rise to the challenge and cope and manage with whatever nursing school is throwing your way, okay? So there is that. So the very first way that nursing students struggle that is 100% avoidable is simply by being unorganized. So I recently just wrapped up a 5-day challenge where I worked with about 1,000 students, a little over 1,000 students in that challenge to do some basic organization for nursing school. And I am telling you, you guys, it was transformative for so many of them. So in nursing school, you are slammed with a ton of paperwork. You're slammed with a ton of tasks. You've got quizzes, pre-quizzes, post-quizzes. You've got discussion board posts. You've got a lot of paperwork, your notes, etc., your PowerPoints from your instructor, reference sheets, forms to fill out. I could go on and on and on, right? So it's a lot of just paper and tasks. Then you have a learning management system to learn that you may not have used before, like Canvas or something like that. And it's cumulative, right? It wastes a lot of time and it causes an enormous amount of stress. And Teresa, I'm so glad you enjoyed the 5-day challenge. I had super fun with you guys as well. So I want you guys to think about your organization and your systems and think about the last time you went and looked for, let's say, a document or something that you needed. How long did that process take? If you spent 10 minutes hunting for your car registration or whatever, and you do that 3 or 4 times a day, that time is really, really cumulative and it adds up. So before I really got into organizing my systems, my files, my where things are, it could take me up to an hour to find something critical. Nobody has that kind of time to waste. My goal now is to be able to put my hands on whatever it is I'm hunting for within a minute. And I'm pretty darn good at that because I have set those systems in place. So getting organized before school starts, you guys, will alleviate so many of those struggles for you, okay? So think about developing systems. And by systems, I mean something that you set in place and keep in place, okay? So a system for all of your paperwork, a system for your digital files, a system for how you're going to keep things rolling at home, okay? Because some of that's going to have to go on autopilot. Okay, so being unorganized, huge cause of nursing student struggle and stress, 1000% avoidable. Try to make it a bit of a priority for yourself before this semester starts, if it's your first or your last, to get some systems in place and see how that changes your experience 100%. Okay. The second way that students struggle, that is completely avoidable, is with just basic poor time management, not really understanding how to prioritize, not understanding what to spend time on and what not to spend time on. There's also procrastination, which is a horrible, horrible thing to do in nursing school. Once you get behind in nursing school, it's really, really hard to catch up. When I was in my first semester, really intense schedule. One student, he was sick for 2 or 3 days, missed not even a full week of class, missed 2 or 3 days, decided to drop out of the program because he saw that he was never going to catch up. And that was just a couple of days. If I were a history major, I could probably catch up, right? If I missed a couple of days of class. Not so in nursing school. It's totally different kind of animal. So procrastinating is another way that students really struggle because that time management. With poor time management, you always feel like you're trying to catch up and stay ahead, right? Or you're on that hamster wheel. It's an enormous amount of stress and it feels like a really big struggle. So if you're not planning your time well, not studying well, you risk writing papers in the middle of the night, or cramming for exams. And nobody wants to walk into an exam that you've crammed for, right? Nobody wants to turn in a paper that you threw together and really didn't get time to proofread. So taking that time to do some really good time management. Look at your schedule. Prioritize your task for the day. Be realistic about how long it's going to take you to do certain things and stick to that, okay? Decrease your distractions. All of those things are going to help you immensely. Now, if your school is nice, like mine was, they opened up some online modules before classes started. And there were definitely two camps with this. The turbo students, like I was, who jumped in there and did as many of those modules they could ahead of time. And then I'm not doing a darn thing before classes start contingent over here. So come week 2 or so, guess who was having a way easier time? The students who did the online modules ahead of time. So if your school gives you anything to do before classes start, even if it's not required to do it before classes start, do yourself a favor and please do it. You will thank your future self, will thank your past self very, very much. Okay. When you're looking at your schedule, you guys, there's a lot of talk, planners. I make a planner for nursing students. So I'm deep into, I'm in the planner camp for sure because that's what works for me. But I want you to look, it doesn't really matter what kind of planner you use as long as it's a system that you use, right? We're talking about starting something and sustaining something. So as you're doing it, you need to just keep on top of it. It's not enough to just have a list of things to do. You really need to do that time blocking and that prioritizing that I mentioned before, okay? And if it were me, I would figure out my planner system before classes start. Like I wouldn't go in and try to learn how to maximize Google Calendar if I'd never used it before. I'm not going to set that up on the first day of class or that first week. I'm going to do that, in the 2 weeks or so before classes start. Get used to using it, get used to putting things in, get used to checking it so that it becomes a system that you sustain, okay? All right. And then paying careful attention to your time wasters, you guys. Big study groups. Somebody in the Facebook group just mentioned this not long ago that, or maybe it was on Instagram, somewhere someone made a comment about study groups becoming social hour and being a huge waste of time. And I've talked about this so much, and I know a lot of students really rely on study groups, and they can work really well if they have structure. But if you have a study group and you're starting to kind of feel like there's no structure, there's no goals, it's more of a gripe session or a social hour. I'm all for social hour, but you need to have clear boundaries about what is social hour and what is study group, right? So I'll put a link in the episode notes or the comments about I have a podcast episode about study groups. So and I think I'm talking about it on the Mindset Edit as well, so that you can try to start setting up your study group with structure so that it does work. Okay. But it can be a big time waster. Distractions are huge. I get distracted when my email dings, right? So I finally started closing my email and only opening it at certain times of the day. Social media obviously is a big one. And then another one that's huge that we don't give enough voice to is indecision. Being undecided is a huge time waster. How many times have you know you got to do stuff for school, you sit down and you've so much going on, you don't know where to start, you kind of spin for a little while? Do you ever do that? I do that when I've got way too much going on, right? So indecision is going to waste so much time. So again, it's looking at what you have to do, time blocking and prioritizing are key. That is going to be the backbone of your time management. Another huge way that students struggle that they absolutely don't have to, okay? Elizabeth is talking about study groups, sticking to one or two people. That's great, Elizabeth. That's how I prefer to do study group. One person, maybe two, but usually I would do it with one other person that studied in the same way as me. And we would take turns quizzing each other, or, I would just say, okay, tell me what you know about, you know, taking care of patients with diabetes, and just let the other person just kind of teach you about diabetes, and then taking turns doing things like that. So that is a really great way to do it. Liz asks about forming a study group when school is online. Lots of students have had success with this. I would say, as soon as you can get into your online portal at your school, put a message out there that you're looking for a couple of students to be study buddies with. Even if they're not in your study group, you know what is super helpful in nursing school is to have that person or a couple of people that you can reach out to when you have a question and you really, really can't figure it out on your own, versus having to, wait for the instructor to get back to you or what have you. Having somebody to just reach out to you and say, hey, do you remember where class is today, is huge, okay? So I would go into your online portal, put it out there, but be very strict on the boundaries you set around that, because most likely if you put out a message, hey, I'm looking for a study group, you're going to get more people interested than what you want your study group to be. So I would have some clear boundaries. I'm looking for one or two other people to study with. And if you want to get even more clarity around that, I'm looking for other people to study with who are also auditory learners, or who also are very visual learners, or something like that, if that helps you, okay? All right, Annette says a few of them that live together, study together. That is great. Oh, yeah, Jennifer and her husband studied together. You're both in school. And then Jennifer says you could do Zoom sessions. You absolutely can do Zoom sessions. Okay, great. So that is the second way. Students struggle. I don't want you to. Going into it knowing that that struggle is avoidable is huge, so that you can take steps to avoid it completely. Another way the students struggle that is avoidable, it just takes a little bit of work, you guys, and a different way of thinking, is a lot of students have difficulty bridging the gap into critical thinking and thinking like a nurse, okay? Nursing school test questions, nursing school knowledge, it's all application knowledge. You're not going to go in and take a test that asks you a straightforward question. I wish, right? They'd be so much easier. It's going to ask you kind of a scenario-based question, and then you have to be able to think about 2 or 3 layers deep to answer the question. So I'm going to give you an example. You're never going to get a test question that says, does furosemide cause hypokalemia? So to translate that for the new nursing students who don't know what those words mean, that's okay, you will. Does Lasix, a common diuretic, cause low potassium levels? That will never be an exam question in nursing school. Sorry. It's going to be more like something like, your patient is on a continuous furosemide infusion. What nursing action would be most appropriate? And then you'll have 4 choices. And those choices could be teach the patient that they should not eat avocados. Okay. Another option could be Assess their hemoglobin every 6 hours, you know, trying to see if you know what furosemide is for. Another option might be assess urine output once a shift. Well, that sounds pretty good. A diuretic, urine output, maybe. Or the fourth option might be place the patient on a cardiac monitor. So Lasix, furosemide, is a diuretic that causes the patient to lose potassium. It causes hypokalemia. So you are not going to instruct them to avoid avocados, right? Because avocados have potassium. You would need to know A, that furosemide causes hypokalemia, and that B, avocados contain potassium, in order to understand that this is not the right answer. You wouldn't want this patient necessarily to avoid potassium containing foods because they're already low on potassium. So it's not A. And then that second option about the hemoglobin, for this one, you would need to know that hemoglobin is a test of the blood count and that furosemide has nothing to do with the patient's blood count, right? And then that third choice, assessing the urine output. This question makes you dive into knowing that furosemide is a diuretic and that it's going to cause increased urine output. That one sounds pretty good, right? And then that fourth option about the cardiac monitor, you might be like, why? This is a diuretic. This is not like digoxin or amiodarone or anything like that. So this answer is asking you to dive a little deeper. It's asking you to know A, furosemide is a diuretic. B, furosemide exerts its influence on the loop of Henle. Third, that the loop of Henle is where a lot of potassium shifting going on. So we know that furosemide causes potassium losses. It also asks you to dive into knowing that potassium is critical for cardiac function. And then you can answer this question and be like, okay, I'm going to put my patient who's on continuous furosemide on the cardiac monitor because they are very high risk for significant hypokalemia. So you see how it's not just going to say, does furosemide cause low potassium levels? It's going to ask a question that makes you think through several layers. So students often a little shocked at that initially and have a hard time making that adjustment. So nursing questions, absolutely application based. And the reason we're not going to just check the urine output every shift, you guys, is because they're on that continuous infusion. We would check it every hour, every 2 hours at the absolute most. Okay. All right. So application knowledge. The tip with this, you guys, is as you're studying, as you're learning, shift how you think. Shift how you think about what you're learning. You're always thinking, what am I going to do about it? That is the number one question as a nurse that you will ask yourself all day, every day. You're going to see an issue and you're going to say, what am I going to do about it? You see problems and you fix problems. I say this all the time. If you can shift how you think into being a problem solver, you're going to make that transition really, really well. And you're going to struggle so much less with it. That's all it is. Become a problem solver, not a fact finder, a problem solver. Okay. Does that make sense? Okay. Annette says, I'm just going to answer this question real quick. So SATA questions, Annette, that's another mindset shift. They have a bad rap, right? Students are terrified of select all that apply questions. And it's because they look scary. There's so many options. With the next generation NCLEX that is coming up, there's going to be more options with your select all that apply questions. But the last time I checked the NCBSN website, the information provided said that they were going to give partial credit. So that's good. But in nursing school, often the select all that apply is you either get them all right or you miss the entire question. So it's a high stakes question. And for that reason, students get all up in their head about it. And I totally get it. But if you can shift how you think about select all that apply, you'll do fine. You just, instead of looking at it as one question with 5 options that seem overwhelming, break it down. Tell yourself, I'm going to answer these 5 questions. And that's all you need to do. You look at the first option and say, does this meet the criteria? Is it true or false? Don't overthink about let's say you think it's all of them, and then you're going to start playing that game in your mind where you say, well, why would they write this question and have it be all of them? Don't second guess the question writer, okay? That will waste a lot of time and energy. Just if it's right, it's right, okay? It might only be one. It might be all of them, okay? So go through each one individually and you're gonna have a lot more confidence and way less anxiety about select all that apply. I promise, okay? Yeah, Deborah, exactly. Exactly. Deborah's been there. She's been there and done that one. Okay. The fourth way students struggle, completely avoidable, you guys are going to avoid this, is not studying effectively or maybe not finding their rhythm and studying efficiently. And to this, I would say you got to understand your learning style. Even if you think it's one way, I want you to take an actual learning style assessment. And I will link to the one that I really like. It's very helpful. In a couple weeks, I don't know which day exactly. Let me see. On the 20th of July, I will be talking more about learning styles, okay? And how to use your predominant learning style and in what part of nursing school that's going to be an advantage for you, okay? But I want you to go and take a learning style quiz as soon as you can. Even if in the past you were full on visual, that changes, especially if you are a returning student, an older student, as we say, or a non traditional student. Your learning style could be completely different from what it was 10, 20 years ago when you went to school, way back with your first degree or back in high school or what have you. Take a learning style assessment quiz and understand that you will have a predominant style, but you will be in nursing school, you still have to use all your faculties. Because when you're at the bedside or you're in simulation lab, right, you're going to get data coming in at you in all kind of ways. The data coming in at you about your patient does not care if you are an auditory learner or a visual learner or a reading learner. It's going to come at you the way it comes at you. So you do have to get used to taking in data from multiple different ways. You're going to have visual data, right? So that could be what your patient looks like or numbers on a monitor, right? You could have numerical data, which would be maybe your vital signs or labs that you're analyzing for your patient. You're going to be reading a ton because your patient has a chart, right? With tons and tons of notes and information in it. And then you've got the data that you take from, touching and doing with the patient. So learning how to kind of tap into all the learning styles is going to help get your brain firing in all these ways. Yes, you'll still have your predominant way, and I want you to maximize the heck out of it in nursing school, but understand that you're going to have to kind of make some neuronal pathways that help you clue into these other ways of thinking, because that's what's going to be happening at the bedside, okay? Another way that students maybe don't study effectively or efficiently is maybe you rely on how you studied in your prereqs. And that may not work at all for nursing school. It really depends on the style of studying that you had prior. Any kind of passive learning where you're sitting in class, taking notes, maybe doing some flashcards, that's not going to be enough. Okay. You have to be really, really engaged in the process. And I know that's hard with online classes, which a lot of schools have, a significant portion of their classes online. Yes, I am talking about staying engaged in online classes with this mindset edit. But just know that if you haven't thought about how you're going to shift up and level up your studying and your class engagement, that's going to have to shift for you to really succeed, okay? And then the other thing I want you guys to do is there are going to be times in nursing school when you don't perform up to the goal you set for yourself. I'm not going to call it a failure, okay? It's never a failure, because as long as you learn something from it, it's not a failure, okay? But there will be times when you don't reach your goal. Maybe you don't pass your dosage calculations exam on the first try and you got to go back and do it again. Okay, fine. But the point is, when you have a setback or when you don't reach a goal, if you keep doing the same thing you were doing, you're probably not going to reach your goal, right? You have to immediately put on the brakes, stop, do an assessment, okay? Think like a nurse. Do an assessment. Do an assessment on yourself, your studying, all of that. Identify the problem and fix it, okay? You have to do that. You can't take 2 or 3 exams studying and preparing in the same way and doing poorly one after the other, if you don't turn things around really quickly, there's a very, very real risk that this is not going to go the way that you want it to go. So, even one assessment or anything that doesn't go the way you want, identify, reassess, reevaluate, and replan. Okay. And then overstudying is another way of not studying effectively. Yes, it is possible to overstudy in nursing school, you guys. If you are studying and you are not regularly having what I call aha moments where your light bulb is going, aha, oh, I didn't know that, or oh, that's really interesting, then you are overstudying or you're not studying the right material. Okay. So as long as you're staying engaged and your brain is firing and you're encountering new information as you study, you're learning. If you're not, you're overstudying. It's time to move on. Okay. All right. Does that help a little bit with studying and the mindset around that? Jennifer says her learning style changed completely. Yep, it absolutely does, and it can. And Melissa loves true or false for select all. Yep, it totally works, Melissa. Totally works. Okay, and then the last one, you guys, and I am doing a whole talk on test anxiety, but I just want to touch on it very briefly here. It is probably the fifth way that students struggle. They agonize, and it crushes me to watch them go through this. Significant test anxiety, like with that select all that apply, right? You're already having anxiety about that. It hasn't even happened yet. So I hope that you can maybe shift how you think about test taking. Test anxiety can be debilitating. You can be the smartest, brightest, most prepared student in the world and do poorly on an exam or an assessment of any kind because of your anxiety surrounding that. We are going to overcome that, and we'll talk about it way more in depth coming up in another one of these sessions. Understanding first that it's okay to have test anxiety, I think, is probably the biggest part of accepting this and giving yourself some grace around it. There are so many reasons that you would have test anxiety in nursing school. I would honestly be a little bit surprised if someone said they had none. Okay. So lots and lots of reasons, and it's okay. We've got really high stakes exams. We've got a grading scale that is ridiculously crazy, right? Our exams are timed. And now, if you take an online exam, there's some stranger watching you. Like, there's a lot of reasons why we might have some test anxiety. It's okay. The right amount of anxiety amps up your readiness, amps up your alertness and your hypervigilance. And that's exactly the kind of level you want to be at when you're working with patients, right? You want to be like, I don't know if you guys have seen like those hunting dogs that are always just like ears perked up and super aware of what's going on around them. That's what you want to be like, not the dog that's, shaking and tremoring in the corner because they're so scared. So, for my dog loving friends out there, I hope that was helpful. So if you're really anxious, really scared, your cognitive function, your decision making, they just tank. A little bit of anxiety, on the other hand, can make you more hypervigilant and more acutely aware of what is going on. So we'll talk a lot more about test anxiety. Let me just see if I can real quick find the date for that. I can't see it right off the top of my head, partially because I scribbled, but it's coming up, and I'll also put the link for the schedule so you guys know when things are happening and when I'm talking about them. Okay. All right. Ashley has a question. Should I start looking at my textbook now? I started taking NCLEX tests. Ashley, that is awesome. So yes, I always tell students the time to start prepping for NCLEX is basically day one of nursing school. So what I would do, Ashley, I don't know if you're aware of my boot camp, but skipping right into NCLEX questions before you've got foundation background knowledge might not be the best use of your time. You can learn some things because what you learned in anatomy and physiology is sometimes enough to answer some of the questions if they're not too complex. And if that helps make you feel more confident, then absolutely do it. I'm going to include a link to my Crucial Concepts Bootcamp, which is a nursing school prep course, which I think some of the people that are watching are in if they want to pop anything in the comments. But it teaches you some core foundation concepts so that You can know how to be successful in nursing school. That would be worth looking into. It's on sale right now with some pretty good bonuses and a really good discount. So I'll include the link to that, Ashley, and you can check it out and then reach out, of course, if you have any questions, okay? Annette says, awesome way of looking at test anxiety. Absolutely, Annette. Give yourself a break, okay? There's a ton of reasons why you would have it. Emily says that, hang on, I want you guys to see this because this is good. Learning style changes based on the type of class I'm taking. It absolutely does. And knowing that, so many students will say, I'm taking X class, I'm taking OB, and I don't know how to study for it. Or I'm taking pharmacology and I don't know how to study for it. It's because you have to really look at learning styles, how the information is presented, and what matches up the best with that. So I love that you recognize that, Emily. Annette says, do the boot camp, it's priceless. Awesome, Annette. Oh, Ashley's done boot camp. Okay, great, great, great. You're on Beyond Boot Camp. Okay, so you're a veteran. Then you're in great shape, Ashley. You absolutely are. So you probably do have enough, a little background knowledge to start doing the NCLEX practice questions. And what's going to help you mostly with that maybe isn't so much the content, it's getting used to how they are written and like, what is it getting at? Right? So definitely keep doing that. I'm super glad that you are in boot camp. And then Kalaya says, I'm in your program, almost done and love it. Oh, you feel so much better. That is amazing. I love hearing that, you guys. I see students struggle and it breaks me. And to know that I can help you in any way just makes me so, so, so happy. So I'm on a mission to make nursing school better for everybody, right? Okay, you guys. So that sums up today. Tomorrow we're talking about negative self-talk and how it is one of the things that can really sabotage your success. Again, we can do something about it and we will. And I don't have the time off the top of my head. Let me just glance at my schedule here. That's at 5 p.m. Pacific tomorrow. Okay, so I hope to see you back for that. And then the recording should still be available on the Straight A Nursing Facebook page. It should still be available on the YouTube channel. So if you miss one, don't stress about it. Come back and you should be able to find it. Okay. Thank you so much. I will see you guys tomorrow. Hopefully have a great rest of your day. Okay. Bye.